Okay, so now make we talk about the treatment of this particular diabetes. So we go talk about treatment. Okay. Now make we talk about treatment for type 1. Type 1, wetin be this treatment for type 1? Insulin therapy. Insulin. So why we go use insulin to treat type 1? We go use insulin because the problem be say the beta cell wey suppose produce insulin, e don dey destroyed. And remember say I tell you say, before symptoms of type 1 go show, 90% of the beta cell don dey destroyed. So you need to replace the insulin. So na like replacement therapy. And now people actually fit do am. Dem get these insulin injections wey you fit dey give yourself. Even the pain one don even come herself. So e dey very easy to manage the condition. So with that, you inject yourself with the insulin go come attach to the insulin receptor, gate man go come open gate, then glucose go come comot for blood, enter inside your body. So this one dey very, very important. But make you dey careful how you go take the insulin too, because if you give excess dose by mistake, e fit lead to hypoglycemia. You understand? Wey no dey very good. Wey the symptoms dey weakness, tiredness. E fit even lead to syncope and all that as well. Wey be fainting. Wey no dey good. Now, type 2. Make we talk about type 2. Type 2. Type 2. The treatment for type 2 na wetin I describe as WEHA. E-H-A. So this one na weight loss. Weight loss. Like I say, one of the problems na obesity. Obesity dey cause one of the risk factors wey dem don find out say e dey cause insensitivity of the insulin receptor. So this one na weight loss. This one na exercise. So exercise now dey connected with weight loss. You understand? So you go exercise, like me. When you exercise like me, you look like me, then you go come any of you wey dey laugh. I will catch you. So exercise dey part of am. Now, another thing na healthy diet. So you need to meet nutritionists. Nutritionists go tell you exactly what kind of food wey you go eat. No go meet my kind of friend nutritionist. He know wetin I dey talk about. So nutritionists tell you healthy diet. May eat food wey dey less of carbohydrate inside. At least eat food wey get more of balanced diet, more of protein, more of raw veggies wey go help you as well. Nutritionists go give you the list of those meals. Go do okay. Now, also we dey use some sort of anti-diabetic medication or anti-diabetic medications. And those medications, for example, metformin, metformin, we also use metformin as well. We have some of the anti-diabetic medications. So mostly type 2 na more of lifestyle, changes. Now if it help you, but you also if you use metformin or other brands of anti-diabetic medications to actually help yourself. But in case all this one self no gree work, we also go back sometime to use insulin. You understand? To actually treat this condition. So make you understand the difference. Say this one na classically insulin that we dey use, and in this case we fit use WEHA, weight loss, exercise, healthy diet, and of course anti-diabetic medication. Now, quickly, I would like make we talk about some other type of complications where you fit see. Some other types of complication where you fit see. One type of that complication where you fit see na say retinopathy. Say when this diabetes don't happen, it dey also cause problem for the eyes. You go see flares. Flares for the eye, or cotton wool spots. For the eyes, cause retinopathy wey fit even lead to blindness. So na retinopathy. Okay, another thing wey fit happen be say, say this diabetes, they affect mostly medium and large arteries. You understand? It affect mostly of these arteries. So when it affect these arteries, it will lead to atherosclerosis. And this atherosclerosis, the two things. When atherosclerosis now, when of course there's narrowing, when there's a defect in the inner layer of the artery, wey go come lead to accumulation, and all those things go come lead to narrowing of this hole now go come dey narrow, so the amount of blood wey dey pass there go come dey low. E fit lead to stroke, cardiac arrest. So this one are some of the complications wey fit come just because of this diabetes mellitus. Another thing wey you see here be say capillaries, tiny capillaries, those tiny cells, blood vessels wey dey hardened, just like we dey get arterial sclerosis as well, hyaline atherosclerosis wey dey happen to some of the arteries. Capillaries go dey hardened because of this deposit, and those capillaries, since capillaries dey hardened, and the capillaries dey help us do the gaseous exchange between blood air blood tissue barrier, this tissue blood barrier, you go come lead to hypoxia. Hypoxia na when we say there is no enough oxygen to the tissues, and tissues go fit come die, come necrotize. Another very bad thing be that. Another complication wey we fit get again, wey patient fit get or wey person fit get, because we no go get am. Say amen. We no go get am. Another thing be say your nerves, the nerves fit dey affected, and we'll get the classical wetin they call stock and glove and foot, wey they call them polyneuropathy, stock and glove kind of symptom, wey be say the distal part of the fingers and the toes go dey affected, and then they call them polyneuropathy. Another thing be say the autonomic nervous system go dey affected as well. Autonomic nervous system na the system wey dey control all the sweating and everything wey dey happen, GI tract and everything, gastrointestinal tract, this tract with food and every other thing go dey affected as well. Now another thing wey fit also happen na say, imagine say now this nerve dey affected and blood vessel dey affected, wetin go happen? Problem is say blood no go come flow go some certain part of your body, and if blood no flow go some certain part of your body, and e go come dey cause what? Death of the tissues wey dey there. And say sometimes you come get small injury for that side, that injury no go heal because blood no dey reach there, and that injury no heal, you go come lead to, you go come see some people leg wey be say you go come reach bone, and then they feel pain again because no nerve, no nerve endings where they work there, they no dey feel any sensitivity, and that will even further complicate more and more problem, more yama, can lead to amputation. Because now when it don't the chop reach your bone, no blood they flow there, no nerve connection, you don't feel anything, as it be, a very bad situation. I don't want to describe that bad situation because God no go allow any of us get that kind of bad situation. You can lead to amputation of that part of the body. You understand? So this diabetes now very dangerous person. I want to make we try our best to throw away this diabetes out of our lives. So the thing you need to do and monitor the kind of food you eat. Very important. Try to do exercise. Try to be active. Try to make sure, say, when you see one small sign of diabetes, you don't run go hospital, make them check. Make sure, say, nothing like that dey your body, dey with you or your family. Push even your family member when no one gree go test. Push them, make them check their glucose level. Because if something happened to them, you can see everything we talk here dey possible to happen if the person get diabetes. Imagine stroke. Stroke na that one wey be say the person no go fit stand again. If it be partial stroke or if it be complete full stroke, e no make sense, e no good. Make we try for the prevent this thing. Then say, we hear something, you no go enter wahala. So I beg, now they beg us, carry this information, tell your friends, your family members, people where they around you, make them make sure, say, then take their hand, their ear, every part of their body, try, make them not for catch this condition what they call diabetes mellitus. Thank you very much for being with me. Thank you, say you follow me for this particular series. We get other ones we don't do. Go watch them as well. Go listen to them as well. Okay? If you get any question, feel free to write us for the comment, the email. If you even write me for the Instagram or Facebook or even on our YouTube channel. See you in the next series. Thank you very much. May God bless you. Thank you.